Biological actions of serotonin 5-HT. Number one, effect on nervous system. This is the CTZ, chemoreceptor trigger zone, which is connected with VC vomiting center, and then they are connected with stomach through vagus nerve, that is cranial nerve number 10. The activation of 5-HT3 on the afferent vagus nerve ending at the GIT gets stimulating through the release of acetylcholine. They are stimulating the CTZ. अब CTZ पे भी 5-HT3 पाए जाते हैं, and then this is also stimulating because these 5-HT3 are excitatory channels. Then this, once the CTZ is stimulated, this through intracellular signaling, this CTZ stimulate the vomiting center, and then vomiting center is producing emetic reflux, and there is a emesis. Once the vagus nerve is stimulated, it also stimulates this vagus nerve stimulating release acetylcholine in the heart, where acetylcholine interact with M2 receptor, and M2 receptor is inhibitory GI inhibitory receptor, and when this is inhibited, there is dilation, and this dilation, this inhibitory action producing bradycardia, this producing hypotension, and this mechanism, this bradycardia, this hypotension is known as chemoreceptor reflux, or it is also known as Bizold-Jarisch reflux. This Bizold-Jarisch reflux is activating, stimulating, increasing this reflux by the nicotinic agonist and some glycoside like ubane. So what is the Bizold-Jarisch reflux? Bizold-Jarisch reflux is actually the activation of 5-HT3 on the afferent vagus nerve ending. Once they are activated, the vagus nerve ending releasing acetylcholine. This acetylcholine interact with M2 receptor, and this M2 is GI and producing bradycardia and hypotension. This is known as Bizold-Jarisch reaction, and this activation also leading emesis. That's why we are using ondansetron as 5-HT3 blocker. 5-HT3 blocker, ondansetron family of antiemetic drug, is a very best and potent drugs to stop all type of emesis, including chemotherapy induced emesis. The chemoreceptor, what is chemoreceptors? This is the brain, cerebrum, pons, medulla में chemoreceptor पाए जाते हैं. Chemoreceptor are those receptors which respond to change in partial pressure of oxygen and carbon dioxide in blood and CSF. Once there is change in CO2 or oxygen in the blood or CSF, these chemoreceptors are stimulated. These chemoreceptors are located centrally in medulla as well as peripherally in aorta or carotid bodies. For example, once there is increased CO2 due to exercise or extra physical activities, this increased CO2 leading increased carbonic acid producing more proton, more acidity. This is known as acidosis, and this is metabolic acidosis. This metabolic acidosis stimulating respiratory center here this respiratory center stimulating chemoreceptors, and this chemoreceptor then increasing this stimulated chemoreceptor causes hyperventilation to release extra CO2 to exhale CO2. Once the CO2 level is decrease carbonic acid, decrease proton, and the blood acidity become normal. So they are known as chemoreceptors, which respond to the chemical condition of the body. Once the vagus nerve, nerve number 10 is activated, स्टाइलकोलिन रिलीजिंग हेयर इधर तमाम में रिलीज़ हो जाते हैं. तो एक्सेप्ट हार्ट में स्टाइलकोलिन प्रोड्यूसिंग the rate and force of the heart muscle is decreased. There is bradycardia, decreased heart rate due to cholinergic activity. While due to cholinergic activity, there is bronchoconstriction, there is increased GIT secretion, there is increased bile, there is increased pancreatic juice, increased urination, and increased secretion of large and small intestine, and increasing mortality. So, next effect is effect on airways. 5-HT has small direct stimulatory effect on the human airways normally, but once there is increase serotonin, this increased serotonin releasing acetylcholine from vagus nerve endings, and these acetylcholine, these serotonin once interact with 5-HT2 or 5-HT4, which are GS coupled, increase intracellular calcium. This increased intracellular calcium causes increased bronchoconstriction. But in the patient of carcinoid syndrome, what is carcinoid syndrome? This is the carcinogenic phenomena in the stomach. Enterochromaffin-like cell hyperplasia of enterochromaffin-like cell is known as carcinoid syndrome. You know that 90% of serotonin found here. Once there is hyperplasia of this ECL, mean that more ECL are found and more serotonin is present. So in carcinoid syndrome patient, there is high concentration of 5-HT3. So this patient may there will be asthmatic attack, there will be continued bronchoconstriction. So in carcinoid syndrome, there will be episodic contraction of the bronchioles due to more serotonin. There will be hyperventilation. Why? Because stimulating serotonin causes basal gyrus reflex or chemoreceptor reflex.